Okay, students, welcome again. We are proceeding with the physiology, and our discussion is still in endocrine physiology. And today we are starting to discuss the pituitary physiology and its clinical correlation. My name is Dr. Machera, and these lectures are dedicated to clinical officers and students. In this session, students will have to pass through the following learning objective. Number one, we have to describe the structure of the pituitary gland. Of course, this is very important to understand the anatomy of the pituitary gland before discussing its physiology. Number two, we have to mention the hormone of the anterior pituitary gland. To mention anterior pituitary gland, this just tells us that the pituitary gland is divided into anterior and posterior pituitary gland. We shall see this as we are proceeding. We also have to describe the growth hormone together with the prolactin hormone and the other tropic hormone which are produced by the pituitary gland. And we have to describe the control of secretion of these hormones which are produced by adenophysis. Of course, to insist adenophysis, this is the terminology which is equal to anterior pituitary. Posterior pituitary sometimes is also known as the neurohypophysis. I would like to start with a clinical scenario where a knowledge of pituitary physiology is very important so as to understand the underlying pathology in the pituitary, particularly when we are encountering patients who present to our medical centers with the pathologies of endocrine gland. It's very important to have a fundamental understanding of the physiology before so that you can easily understand the pathology. This case is about a 44 years old woman who presented to her gynecologist with a complaint of not having period for the last 8 months. She reported a negative pregnancy test at home. Of course, any woman who misses menses, the first thing to think should think of pregnancy. And because urinary pregnancy test is a very simple test, it can be done at home. That's why this woman did urinary pregnancy test at home. Upon further questioning, the patient reports a daily headache, change in vision, and the milk discharge from the breast. Of course, milk discharge, we shall see the relationship between prolactin hormone, which is responsible to secrete milk, and also we shall see why the patient has a headache and a visual disturbance. You remember when we were discussing the hypothalamus, we said the hypothalamus, these are the structures, it's the structure underneath the thalami, and in front of the hypothalamus was the optic chiasma. Optic chiasma, this is the cross-section point where the two optic nerves do cross the fibers of the optic nerve from eyes do cross, and this point is in anterior aspect of the hypothalamus, and the pituitary we shall see is below the hypothalamus. So when you have any pathology, particularly neoplasia, which are growing either in the pituitary gland, they are likely to compress the optic chiasma and they lead to visual disturbance. On physical examination, she's noted to have galactorrhea. Of course, galactorrhea means milk discharge and diminished peripheral vision bilaterally. The remainder of examination is normal. Again, a urinary pregnancy test repeated in hospital was negative. Why? Because the doctor has to prove again whether the patient is not pregnant or not. So the first urinary pregnancy test was done at home. Now the second has been repeated in the hospital by a doctor. A thyroid stimulating hormone was done and the result was found to be normal. After a thorough workup is complete, she is found to have a prolactin secreting pituitary adenoma. As I said, adenoma, this is a neoplasia of the pituitary secreting excess amount of prolactin hormone. That's why the patient was having high level of prolactin hormone, because prolactin hormone is responsible to secrete milk. That's why the patient has a milk discharge. And also we shall see the relationship between high level prolactin hormone and the loss of menses. Okay, after having passed through that clinical scenario, we had the question which was supposed to respond. Number one was, how does hyperprolactinemia, meaning high level of prolactin in the blood, cause amenorrhea? Amenorrhea again is the loss of menses. Why would a physician need to check thyroid hormone in relation to patient with high level of prolactin hormone, that is hyperprolactinemia? And the last, where are the posterior pituitary hormone produced? Just to mention, the hormone of the posterior pituitary are produced in the hypothalamus. They are produced in the hypothalamus and then secreted into the posterior pituitary, where they are stored. Okay, after having passed through that cases and their questions, now it's time to start our discussion on the pituitary gland. The pituitary gland sometimes is known as a hypophysis. This is a gland which is located in the inferior aspect of a region of the brain known as the diencephalon. Do remember, during embryological development, we have three vesicles. These vesicles, the first one is known as proencephalon. Proencephalon is responsible to develop into the forebrain. And the middle vesicle is a mencephalon, which is responsible for middle brain. And the hind or the last vesicle is rhondocephalon, which is responsible for development into hind brain. So the forebrain, which we are highly interested in this discussion, the proencephalon is divided into telencephalon and diencephalon. Telencephalon is responsible for cerebral hemisphere formation, while diencephalon, this is a region which will develop into hypothalamus, pituitary gland, and the thalami. That's why we say the pituitary gland or hypophysis. This is a gland which is found in the inferior aspect of the diencephalon. Roughly the size of the pituitary gland is about 1.3 centimeter. Just it is very small, and it is attached to the hypothalamus by a pituitary stalk. A pituitary stalk. This pituitary stalk is known as infundibulum. The pituitary gland is structurally and functionally divided into anterior lobe, as I said. This anterior lobe is known as the adenophysis, and the posterior lobe. Posterior lobe, as we saw, is called the neurophysis. These two parts have different embryological origin. When I'm saying embryological origin, because they are originating embryologically differently, that's why they perform different function. The anterior lobe produces hormone, while the posterior lobe does not produce hormone, but it just stores the hormone of the hypothalamus. The adenophysis is derived from the pouch of epithelial tissues. Sometimes this pouch is known as Laske's pouch, which migrates upward from the embryonic mouth, whereas the neurohypophysis, this is just a downward growth of the brain. Neurohypophysis, it is a neuron in nature because it is a downward extension of the brain, while the anterior pituitary is the glandular in nature. That's why we call it adenophysis. Adenophysis, this is for anterior pituitary, while neurophysis is for posterior pituitary. Adenohypophysis consists of two parts. Of course, adenohypophysis, as I said, this is anterior pituitary. It consists of two parts. It consists a part which is a large part responsible for hormone secretion and formation. This part is called pars distalis. Is known as a pars distalis. And the second part, which is a tube-like structure connecting the pars distalis to the hypothalamus via the infundibulum. This tube-like structure is known as pars tubularis. So to summarize, the anterior lobe is divided into pars distalis the part which produce and secrete hormone of the anterior pituitary, and the pars tubularis, through which there is a communication of hypothalamus and the pituitary through the infundibulum. The pars intermedia, this is a third part of the pituitary gland found in fetus. It does not exist in adult pituitary. In fetus, the pituitary is divided into three parts. We have the anterior lobe, which is adenohypophysis. We have the middle lobe, which is pars intermedia, and we have the posterior lobe, which is neurohypophysis. But only this part existing in fetus. But in adult, the pars intermedia or the middle lobe do fuse together with the anterior lobe. They fuse together with the anterior lobe. That's why the pituitary of the adult has only two lobes, anterior and the posterior. Okay, to insist, pituitary is a protrusion of the bottom of the hypothalamus. As I said, it is found inferior to the hypothalamus. The pituitary rests in a cavity-like structure, in the middle cavity of the bony cranium, or basilar skull. This part is known as the pituitary fossa. The pituitary fossa is covered by the dura. Do you remember the brain is surrounded by the pia, the arachnoid, and the dura? So the part of the dura which cover the pituitary fossa is known as the diaphragmatic cell, while the pituitary fossa sometimes is known as the sella tussica. The pituitary secretes hormone which regulate other glands. These hormones are known as tropic hormone. It is functionally connected by the hypothalamus via a medial eminence. Do you remember we said the hypothalamus is the master gland which controls the pituitary? Located at the base of the brain, the pituitary is composed of two lobes, as I said. These lobes are the anterior lobe adenophysis and the posterior lobe neurophysis. The pituitary is functionally linked to hypothalamus via a stalk. This is what we say pituitary stalk or infundibulum, where there is hypothalamic release hormone of the hypothalamus. Do you remember we said the hormone of the hypothalamus, they are releasing hormone as well as inhibiting hormone. So these hormones are secreted and they influence the pituitary via a pituitary stalk, where there is a pituitary stalk, where there is the hypothalamic pituitary portal system. We shall discuss it in detail. Although the pituitary gland is known as the master gland, to insist, it was used to be called a master gland, but it's not a master gland. The pituitary gland is under control of the hypothalamus. That's why it's not a master gland. The anterior pituitary, to insist again, these are the three lobes of the pituitary gland, and to insist, the middle lobe only exists in fetus, while in adult we just remain with the anterior lobe and the posterior lobe only. Functionally, the anterior pituitary, which is responsible to produce the hormone of the anterior pituitary, it has cells which are functionally different from other cells. These cells are a group of cells which are found within the anterior pituitary, and in each individual group of cells is responsible to produce a particular hormone of the anterior pituitary. We have a group of cells known as somatotrophin cell. Of course, somatotrophin means food, meaning this hormone has influence on growth. This is a group of cells which is responsible to secrete growth hormone. We shall discuss it. We have also corticotrophin cell. Corticotrophin cell, these are cells of the anterior pituitary which are responsible to produce adenocorticotrophin hormone. Adenocorticotrophin hormone, this is a hormone produced by the anterior pituitary which affects the release of hormone in the adrenal gland. We shall discuss it, the adrenal gland. And also to mention, the corticotrophin cell have cells which are known as melanocytes. Melanocytes, these are cells which are responsible to produce melanin hormone. Melanin hormone is responsible for skin darkening. Do you remember we said the fetus has a pars intermedia, which is the middle lobe of the pituitary. But the pars intermedia fuse with the anterior pituitary lobe in the adult pituitary gland. So the side of the middle lobe of the pituitary gland, these were melanocyte cells, and when they fused with the anterior pituitary, they came to be combined or to be structurally grouped together with the corticotrophin cells. Another series are thyrotrophin. Thyrotrophin, these are series of the anterior pituitary which are responsible to produce thyroid stimulating hormone. And also we have lactotrophin series. Lactotrophin series, these are series which are responsible to produce luteinizing hormone and follicle stimulating hormone. These are sexual hormone, we shall discuss it. We also have prolactin series which are responsible to produce prolactin hormone, as we have seen in our clinical cases. Pituitary hormone, as I said, these are trophic hormone. Trophic means food. Actually, they are not food, but why do we call them trophic or food? It's because when they act in their target glands, they lead to hypertrophy of these glands. Hypertrophy means increase in size, and under secretion of this hormone, they lead to shrinkage or reduce the size of their target glands. This is known as hypertrophy. That's why we say atrophy. That's why I insist hormone produced by the anterior pituitary, they are known as trophic because high secretion leads to hypertrophy, while under secretion leads to atrophy of their target glands. When the name applied to the hormone of the anterior pituitary, these names will end up with trophic. Conventionally, trophic means attracted to, and that's why the hormone produced by anterior pituitary have the suffix trophin. For example, somatotrophin, thyrotrophin, both of them, they have the suffix trophin. Okay, to start discussing the hormone of the anterior pituitary, as I said, the anterior pituitary, this is endocrine in nature and is responsible to produce this hormone and secrete this hormone, which influence the functioning of the glands in the peripheral. To start, we have growth hormone. Of course, growth hormone sometimes known as somatotrophin. The growth hormone promotes as it sounds, it leads to growth. Growth is the promotion of amino acid. This amino acid will incorporate and join to make protein. And the protein, we have functional protein and structural protein. So functional protein are like enzyme, structural protein, these are responsible for growth. That's why we say the growth hormone stimulates amino acid incorporation to make protein, which are responsible for overall growth of an organ. Another hormone is the thyroid stimulating hormone, also known as thyrotropin. I said this hormone, they have the suffix tropin. The thyroid stimulating hormone stimulates the thyroid gland to produce thyroxine hormone. This is tetraiodothyronine and triiodothyronine. We shall discuss the hormone when we will be discussing the hormone of the thyroid gland. Another hormone of the anterior pituitary is the adrenocorticotrophin hormone, sometimes known as corticotropin hormone. This is the hormone which influences the adrenal gland to secrete the hormone. The adrenal gland produces cortisol, one of its hormone, and the glucocorticoamines cortisol, one of its hormone. We shall discuss it in detail when we will be discussing the hormone of the adrenal gland. We have also follicle stimulating hormone and the luteinizing hormone. Follicle stimulating hormone, this is known as follicotropin hormone, and the luteinizing hormone is known as luteotropin hormone. These are hormones which are responsible for egg formation and the reproductive cycle. The effect of luteinizing hormone in female is the conversion of the ovarian follicle into structure known as corpus luteum after ovulation. And the effect of luteinizing hormone in male is to stimulate the interstitial cell to produce sperm and sex hormone. We have also prolactin. As I mentioned, prolactin hormone is secreted by the anterior pituitary, both in male and in female. But in female, there is a high level of prolactin hormone secretion, particularly during breastfeeding. Its basic function is to stimulate milk production in mammillary glands of women after birth of the baby. Prolactin hormone play a role in regulation of male reproductive system by inhibiting the production of follicle stimulating hormone and the luteinizing hormone. Okay, the second lobe of the adult pituitary gland was the neurohypophysis. As we said, the posterior pituitary is just the extension of the brain, so it's neuro in nature. The posterior pituitary does not produce hormone. They just store hormone released from the hypothalamus. And these hormone which are stored in the pituitary gland, they are antidiuretic hormone. Antidiuretic hormone, this is responsible to promote water retention in the kidney, so that we can retain high amount of circulating fluid in the circulation and increase blood pressure. At a high level, this hormone also can lead to vasoconstriction. That's why sometimes it's known as vasopressin. Another hormone stored in the posterior hypothalamus is oxytocin. Oxytocin is a very important hormone, particularly in female, because it has effect during childbirth. During childbirth, oxytocin stimulates the uterus to contract, and the contraction of the uterus will lead to pushing of the baby out of the uterus, and the pushing of the baby will lead to stretching of the cervical stretch receptor, which will in turn affect the posterior pituitary to secrete more oxytocin. We shall review this when we will be discussing the positive feedback mechanism of the oxytocin. Also, we see oxytocin during lactation. Oxytocin is responsible for milk ejection, while prolactin is responsible for milk formation. So during breastfeeding, the baby stimulates the nipple, and these receptors are sent to the hypothalamus and lead to excretion of oxytocin, which lead to milk ejection. Okay, hormone of the pars intermedia. This is the part of the pituitary which is found in the fetal pituitary, but does not exist in adult pituitary because this part tends to fuse with the anterior pituitary. So pars intermedia is responsible to produce melanin hormone, but the melanin hormone is not produced in inactive form. It's produced in inactive form, which is propiomelanin. This is further breaking down to form melanin hormone, which is responsible for skin darkening. Okay, let us see hypothalamic control of the pituitary hormone. Hypothalamic control of the pituitary hormone, we say the pituitary hormone is under control of the hypothalamus. So the hypothalamus, as we saw, produces hormone which are inhibiting hormone and releasing hormone. This hormone, the releasing hormone, will lead to anterior pituitary to secrete their hormone, while the inhibiting will lead to inhibiting the pituitary gland from secreting its hormone. This hormone which are under control of releasing hormone, we have the adrenocorticotrophin hormone, which is under control of adrenocorticotrophin releasing hormone. Hypothalamus secretes hormone known as releasing hormone, as well as inhibiting hormone. This hormone, they reach the the pituitary via hypothalamic pituitary portal system. A portal system is arrangement of blood vessel in which exists from where a tissue is drainage, and the drainage does not go back to the heart, but rather it go to another organ. That's what we call portal system. We normally know that the vein drain into the heart, but when the vein do not drain into the heart and they drain into another organ, that's what we call portal circulation. So hypophyseal portal system carry blood from the hypothalamus direct into the anterior pituitary adenophysis, and the hormone, and this blood has the hormone of the hypothalamus, which are either releasing hormone or inhibiting hormone. This hormone will influence the anterior pituitary to secrete their hormone. So the hormone which affects the pituitary, we have growth hormone, we have releasing hormone which stimulates the anterior pituitary to release the growth hormone. We have the inhibiting growth hormone. This is the growth hormone this is inhibiting hormone which inhibits the anterior pituitary from producing growth hormone. We have thyrotropin releasing hormone. Thyrotropin releasing hormone stimulates the anterior pituitary to produce thyroid stimulating hormone, which is responsible to stimulate the thyroid hormone to produce thyroxine hormone. We have corticotropin releasing hormone. Corticotropin releasing hormone is responsible to stimulate the anterior pituitary to release adrenocorticotropin hormone, which is responsible to stimulate the adrenal gland to produce the adrenal hormone. We shall discuss it in detail. We have gonadotropin releasing hormone. This is responsible to stimulate the pituitary to produce luteinizing hormone and the follicle-stimulating hormone, sometimes known as gonadal hormone. We have also prolactin releasing hormone, which is responsible to stimulate the anterior pituitary to produce prolactin hormone. And to finish, we have prolactin inhibiting hormone, which is responsible to inhibit the pituitary gland from secreting the prolactin hormone. Generally, the pituitary gland is under control of the hypothalamus, which is adjusted by a negative feedback from the hormone of the feedback mechanism. We saw in feedback mechanism, this is when a gland is stimulated to produce a hormone, and once that hormone is stimulated, will inhibit the initiation of its production and leading to cancellation of the production of that hormone. We discussed it when we were discussing control of the hormonal secretion. Anterior pituitary secretion, for example, adrenocorticotropin and thyroid hormone and gonadotropin hormone, they are controlled by negative feedback inhibition from their target hormone. That means the anterior pituitary will produce this hormone, for example, thyroid stimulating hormone. Once the thyroid stimulating hormone is produced, it will lead to stimulation of the thyroid gland to produce the thyroxine hormone. Once the thyroxine hormone is produced, it will again come to inhibit the anterior pituitary, so that the anterior pituitary will not produce its hormone. That was thyroid stimulating hormone, and this will lead to cancellation of the production of the thyroid hormone. That's what we call negative feedback. Higher brain function and the pituitary secretion. We say there is a relationship between anterior pituitary and particular glands, and this is described as an axis. For example, we have pituitary gonadal axis. This is a relationship between the pituitary and the gonad, and this is stimulated by gonadotropin releasing hormone from the hypothalamus. As we have seen, gonadotropin releasing hormone from the hypothalamus do stimulate the anterior pituitary to secrete follicle-stimulating hormone and the luteinizing hormone, and this hormone will act on the testes and the ovary, lead to sex hormone production. Again, this will have effect on the follicle-stimulating hormone and luteinizing hormone, where it will lead to cancellation. Also, the hypothalamus will receive neural input from higher brain center.